You know what I love about kids? I love how honest they are. I was working at a school-based health clinic the other day, and I asked one of the kids, "What's your favorite subject?" Without missing a beat, he replied, "Lunch." And he's not alone. Did you know that 93% of Americans love to eat? But in all seriousness, here's the thing. That moment made me think about food, health, and nutrition in a way that I hadn't in a while. You see, 12 years ago, I was a pathology resident. A pathologist is a doctor that examines tumors. And I was also a new mom. It was Thanksgiving, and while most people were with their families at home enjoying a meal, I was on call at the hospital. And it was an incredibly busy day. We had tumor after tumor after tumor. I could feel the weight of our work. But what surprised me wasn't just the number of cases, it was the number of cases from young people, from young women, from moms just like me. And as I stood there surrounded by all of these cases, I couldn't help but wonder, why did this happen to them? Is there something we could have done sooner? Is there a way to prevent this? And I've come to realize that the answer lies in nutrition. I know this from my own education. I've completed medical school, dental school, a pathology residency, and public health training, learning how the whole body works and what happens when it doesn't. And nutrition is the missing link that connects everything. What we eat shapes every aspect of our life. And despite the overwhelming evidence, we're still not talking about it enough. I saw this firsthand when I worked at a rural hospital in upstate New York. One day, after a long morning of seeing patients, I stopped by the hospital cafeteria to grab a quick snack. And I asked for fruit. But the response I got, "Doc, we don't keep fruit because no one asks for it, and it just goes bad." I was surprised to hear this. Even in a healthcare setting, surrounded by farmland with fresh produce, people were not choosing healthy snack options. I always thought this was an access issue. I thought people didn't eat healthy because they didn't have access to it. But that's when I realized it's bigger than that. It's more than just an access issue. It's a familiarity problem. People tend to stick to what they know. And this isn't just in rural communities. In my recent work in school-based clinics, I've made it a habit to ask the kids about their nutrition choices. And what I found is striking. Most kids will pick chips or candy bars over fresh fruits and vegetables. Not because they don't care, but because that's what they're most familiar with. And so one day I was in the kitchen again, this time with my niece, my 3 nephews, and my kids. And it was Thanksgiving again, and we were about to make a big batch of broccoli cheddar mushrooms for our Thanksgiving dinner. And my daughter goes, "Did you know that eating broccoli keeps you healthy?" My son adds, "And it can help to prevent cancer." That's when I realized something that I already know. Kids love to learn facts. They memorize them, they repeat them, and they love to educate others. So why can't we use the same energy and creativity to teach all kids about nutrition? What if we taught kids to prioritize nutrition in the same way that we teach the alphabet? Think about how you learned the alphabet. It wasn't a one-time thing. It was instilled in you through repetition. You saw it in books, you saw it on blocks, you saw it in games. It was everywhere. Why? To make it second nature. Now, what if we applied the same principle to nutrition education? Take a child's first exposure to broccoli. If a child is given broccoli on his plate once and told, eat it, it's good for you, they might just push it back. But what if they see broccoli on their plate more than once? What if they see it in their books? What if they see their parents and their grandparents enjoying it? Then, instead of something that's unappealing or unfamiliar, it becomes a part of their world. There's a research study that shows that it takes 8 to 15 exposures to a new food before a child will accept it. And yet, parents will only try 3 to 5 times before giving up, thinking that their child is not going to like that food. And this sense of familiarity is also missing in school lunches. In my recent work in the urban schools that I visit, the lunch options are often cheeseburgers, potato chips, and sweetened peaches. What's missing is kid-approved whole foods. If a child's only exposure to vegetable is bland carrots or mystery spinach, then we can't expect them to crave kale or trust tofu. But in countries like Japan, where nutrition isn't just served, it's also taught, there, kids learn how to make healthy choices. They also learn how to prepare their food and educate and enjoy their food with others. And this builds lifelong habits. In our own home, we try to keep fruits and vegetables front and center when we're cooking, so that if our kids get hungry, they grab a nutritious snack instead of junk food. And you know why I do this? Because my mom and my dad did the same for me when I was growing up. Because it's familiar to me. In fact, my parents have always prioritized nutritious meals. They lead active lifestyles, and they've always made room at the table for community. And this foundation has shaped me and my 2 sisters, who are also both physicians and public health champions. And so when children learn these habits from a young age, they take it to every part of their world. They share it with their friends, their schools, their communities. It's a ripple effect that can transform entire neighborhoods, making wellness a shared value and helping us all and really protecting us all from the threat of preventable diseases like cancer. And so here's the question that I leave you with. What are some small steps that you're going to take to make healthy eating more familiar to the children in your life? Whether it's cooking together, or having an honest conversation about food, or simply leading by example. Remember, change begins with one choice, one moment, one meal at a time. And that time to act is now. And maybe, just maybe then, we can all make lunch the most important subject of all.